welcome to Urban Renal Talk with Tamika.
And Steve, thank you. Welcome. What's going on, Tamika?
Hey, Steve, how are you?
Pretty good. How about yourself?
I'm well. Did y'all have some rain down there?
Absolutely. Had it for a couple of days. It's kind of passed through now, but definitely today we had some.
Yeah, we had a lot up here. It's still storming up here in Philadelphia.
Really?
Yes.
Wow.
Yes.
Wow. Anything else going on?
Um, just adapting to the new normal. Learning more. Trying to educate patients more on like when they touch the scale and touching the door and all those things, and to not keep their gloves on the entire time of the treatment because no one keeps their glove on that long.
Oh, right. Unless their hands are cold.
Yeah, but they wear the surgical gloves that we wear or whatever.
Oh, right.
Or the latex gloves, and they have them on for 4 hours.
Wow.
Mm-hmm.
I know it got to be uncomfortable because just having gloves on when we're doing the treatment is a little uncomfortable depending on what size you have on.
Right. And just trying to help them with the myths that they hear that will help them stay safe.
Yeah. And in fact,
gloves on is not going to do it because you're going to touch your pants, you're going to touch your shirt. Then when you take your gloves off, what you going to do? Touch your pants and touch your shirt.
Yeah, absolutely. In fact, that's what tonight's show is all about: keeping patients on dialysis safe in the midst of this coronavirus disease.
Yes.
And we know the coronavirus or COVID-19, whatever you want to call it, is a respiratory illness that can spread from person to person, and it's similar to the influenza. Very similar.
Right. And it's they even say it's more similar to SARS also. Like they say it's like SARS COVID or something like that.
But you know what, Tamika? I went through the CDC and looked at their recommendations for dialysis patients and keeping them safe. And it mimics, it pretty much looks like the same way you would do for any other virus.
Yes. It's not that much different, except like if you feel sick, to call the unit first so we can make the right precautions for you.
Right. The preparation either to come there or go to the hospital. In fact, that is one of the recommendations under preparing the facility. And here's some tips on take everyday precautions for patients on dialysis. I mean, the biggest one, which we always preached about doing dialysis, is wash your hands with soap and water for at least 20 seconds, or use a hand sanitizer with at least a minimum of 60%. Well, CDC says 60. I know maybe some other places maybe say 70. The more the better, but the least amount is 60%. Anything under 60%, you're doing yourself a disservice.
Yeah, I totally agree because see, when a patient gets sick, they get really sick.
Yeah, and depending on what other comorbidities they may have, Tamika, because some patients, they may not just only have diabetes or high blood pressure. They may have sickle cell. They may have lupus. They may have polycystic, heart disease. I mean, so many. Cancer, COPD.
Yep. And also, Steve, don't forget fluid in the lungs. I'm sorry, fluid around the lungs and fluid around the heart.
Yes. I mean, especially if someone that's in that position gets caught with COVID, that's already in some type of position of respiratory, maybe not be distressed, but may have fluid in the lungs and still trying to get it off with multiple dialysis treatments. And it may not be causing the problem now, but if they got hit with that COVID-19, then it would be pretty much downhill.
Right. And then sometimes, Steve, the symptoms that we think that they're supposed to have, they don't have them. So we don't find out until they actually go into the hospital.
Now, another precaution, Tamika, they had is, in which we all know, avoid touching your face.
Yes. I think that's the hard one sometimes because you just get so used, even with me on this show, sometimes you see me touching this, that itch. I think that's the hardest thing is to not touch your face. See, you just touched your nose.
But I know, but Tamika, the thing is, I wash my hands before the show. If you have hand sanitizer and you just used it, I don't see what would be the problem on touching your nose or a party, long as you're not going to the eyes. If you just use hand sanitizer and washed your hands for at least 20 seconds.
Right.
I mean, that's just logical sense.
Right. But I feel like there could be an overuse of hand sanitizer. Like you can overuse hand sanitizer.
Sure, absolutely. And that's what dries a lot of people's skin. I mean, we know that from working in the business.
Yes.
This hand sanitizer is all on the shelf, on patients' machine. So if you can't get to the sink because you may have gotten your hands soiled or just, need to change your gloves, hand sanitizer is right there. Right. And that's the thing. Before this COVID-19, hand sanitizer was all over the place.
Right.
It was like, it was just running out of people's pockets. I mean, and what I mean is
it was in
you couldn't get enough. You couldn't get enough of it. And people were using it. But that is not, and I repeat, that is not a substitute
for washing your hands.
For hand washing. And I want people to know that you can't always depend on hand sanitizer because before hand sanitizer, it was soap and water.
Right.
And it's always going to be soap and water unless something happens with the water.
Right. They even tell you that they prefer you to wash your hands, but if you're unable to, then use the sanitizer.
Absolutely.
But Steve, what I thought was so weird today is I went into a store and I went into a dollar store and they had more masks in there than the clinics have. And they had more hand sanitizer in there than the clinics have.
So the dollar store is restocked, ready to go.
The Chinese dollar store, yes. They have masks. They have better PPE. I actually bought one of their PPE.
From the Chinese dollar store?
Yes.
Where are they getting this stuff from?
You know what, Steve? If you give me about 5 minutes, I could run to my car and go get this PPE.
Sure.
All right. I'm gonna get off screen real quick. Take me off screen.
All right. So we're going to wait for Tamika to come back with the PPE that is being sold in the hood in the Chinese store, dollar store. So why can't this be universal? We're going to talk about this as well as other precautions that patients on dialysis should take. One thing in particular, everyone should wear a cloth face covering in public setting where other social distancing measures are difficult to maintain. Now, look, let's just think logic sense. If you driving in your car, you leave your house, you haven't been out, you go maybe 20 steps to your car. Why do you have to wear a mask inside your car? I mean, is the COVID-19 in the car? Because I see plenty of people driving with the mask on in the car along with gloves. That is absolutely ridiculous. I don't care how you look at it, okay? How you look at it. You need to put that mask and gloves on once you get into an establishment or public setting where other social distance measures are difficult to maintain. It doesn't take a rocket scientist to know that. Avoid close contact with people who are sick. All right, we got my partner back, Tamika Gaines. Let's see this Chinese PPE. What? What?
Yep.
You got that from the Chinese dollar store.
Yep.
For how much?
$5.99.
$5.99 for that.
Yep, and
I ain't mad at you. And what about Fresenius? Is it better than Fresenius? You know, you're a technician. You work in the field. How does it hold up?
It's good, B, because it doesn't hug your head. It's glasses. So it fits on your face like glasses, and it doesn't hug your head. And
you need to send me one of them.
Yes.
Just in case I go back.
Yes, I sure will. I'll go back there Saturday.
What is that? One size fit all?
It's one size fit all.
Put it back on again? That's crazy. And then you wear your mask under that.
Yep, you wear your mask under it, so it's double protection.
Wow.
Yep. And I was trying to find a name on it, but it doesn't come in any plastic covering. It comes like this. And I seen them wearing it, what made me ask about it, because they have this and they have the plastic glass. Well, the plastic sheet thingy up. Plexiglass up. Yep. That's where all the masks are. This is crazy.
Do you got any PPE?
I didn't get any masks because I do have the N95 and I have the KN95. So I'm pretty good.
Right.
And
I got my grandson called me.
Okay.
and I got him on the phone.
We say, hey, Pop.
You see me? Yeah. Where your sister? I'm sorry, guys. We're gonna get back. You know.
Oh, look at that smile. He's glowing. Oh, it hung up. I can't hear you, Steve.
Oh, sorry. Did you get any PPE like covering other than the glasses?
No, I didn't get that.
Oh, but they had the face shields. That is, I never seen that in the Chinese supermarket. That's a new one.
Yeah. I grabbed
wow.
it.
Do anybody on your job have that?
Nope.
That's your little secret stash, huh?
That's my little secret stash. Well, it's not a secret anymore, but yeah. And you know what? It's so much more comfortable than the headgear that we wear, that heavy.
Yeah, absolutely.
It's so much more comfortable. I could put that on and off easily.
Right. Now, Tamika, I was mentioning before you called. I'm sorry, before you when you went to your car, that everyone should wear a cloth face covering in public setting where other social distancing measures are difficult to maintain.
Yep, I agree.
Yeah.
Hopefully now they're having all the patients wear masks the entire treatment.
Wow. Yeah, they say that too.
Yes. Yeah.
And avoid close contact with people who are sick. But the thing is, how would you know they are sick? Are they letting, let me ask you this, at your unit, do other patients know who has the COVID-19?
No, that's HIPAA.
Okay.
That's from HIPAA. We can't tell them that.
Unless the patient tells them themselves, like say, oh, I gotta go on. But wouldn't they know, like if they don't see the patient, like where Mrs. So-and-so? And saying she had it and she had to go on the third shift, wouldn't that be obvious?
Well, see, the patients aren't stupid, so they see. We just can't tell them. You get what I'm saying? So
Sure.
they're very observative. They pay attention to everything. They know, they see, but we can't just be like, yeah, Joey Green has COVID. We can't say that.
Oh no, not at all. Oh,
But what I do tell them is don't sit there, like spread yourself out because you just don't know, because you have people that don't have symptoms. You
yeah.
can have a patient fine on Tuesday and then wind up in ICU on Wednesday. So you just don't know.
And that's crazy. That's the crazy thing about that, how it can turn so fast.
So fast. You can have a patient fine on the machine in the beginning, when we do the assessments, and then towards the end of treatment, they're transitioning. So they're sitting next to someone outside, in a waiting room for an hour, hour and a half, however long they're there, and you just don't know.
Right.
And then, Steve, think about this. In the bathroom, a lot of people take their mask down in the bathroom. And
really?
Then when someone comes behind them, you get what I'm saying? Like,
yeah, absolutely.
No one cleans up right after someone goes to the bathroom.
Yeah. That
Touching
takes on that whole new
touching the doorknobs in the bathroom.
Yeah, and we talked about that in many of our shows, about wiping it down with bleach and the doorknobs and stuff like that. And I even mentioned it in shows talking about infection control precaution, that people coming into from the outside, the door that goes into the facility, then you got the door that goes into the unit plus the door that goes into the bathroom. Multiple people are coming in. You don't know where they've been. Like you said, people coming out of the bathroom. Say somebody may not wash their hands because not everybody washes their hands. And they touch the door going out after they use the bathroom. So even though you may wash your hands after you use the bathroom, but then you touch that knob going out, not knowing if the person before you washed their hands. And if they didn't, you know that if they had a bowel movement and wiped themselves, some of that fecal matter could be on their door, which can transmit hepatitis A if that person has it. And we don't know who has it because, again, Tamika, you said the HIPAA.
Yeah. So what I tell my patients is I treat everyone as if they have it.
And you know what, Tamika?
Protect yourself.
And that's the thing. A lot of patients don't know this, but that's what they teach us. That's what they taught us. Treat every patient as if they were infected. And to me, I didn't like that concept, but at the same time, you have to practice it. And now more than ever, because a lot of times in the past, and I admit myself as well, I have been very lax in my infection control practices. And I'm not shy to admit it. There's been times where I didn't have on goggles or a mask. I just had on my gloves and I wanted to hurry up and get the patient on. I'm not ashamed to admit that. Right. But now the game has changed. You can't do stuff like that anymore. And that was wrong back then. But again, let me speak for myself. Me as a caregiver, there were times that I have been lax. And when I really realized that I was too lax is when I got stuck with a 14 gauge needle, Tamika, right here between these two digits, and it wouldn't stop bleeding. Of course, I went to Concentra and had my blood work done. However, and this is protocol. They're quick to give you a cocktail, antiviral medication prophylactically. I didn't take it because I know many people who took that and they were sick as a dog.
Mm-hmm.
Sick as a dog. Knock on wood that the person's needle that when I was pulling it out and it reached back and stuck me,
Mm-hmm.
they weren't HIV positive, but just the mental aspect rolling through my mind, thinking about it and flipping through the chart, trying to find any evidence of it is I can't explain to anyone who hasn't went through a situation like that, that's been stuck with a dialysis needle, a dirty needle at that, and not knowing if the person was infected with any type of virus, be it is HIV, hepatitis, CB, or whatever. So, yeah. And
universal precautions. I said universal precautions.
Absolutely. You got to practice that now. And now, Tamika, is one thing that you mentioned about distance, and that's what the CDC recommends as well. If patients didn't know, that goes to in-center dialysis, even if you're sitting in the lobby, because I know some places that let patients sit in the lobby instead of out in the car. You got to maintain at least 6 feet apart just to be on the safe side.
Right. Now, I think that right there is the hardest thing, only because some units don't have that much space. You get what I'm saying?
In the patient lobby.
They don't have that much space. So where the patients are going to go. Now, I do say that sit every other seat. If you can't be 6 feet, sit every other seat and make sure you have your mask on and they have their mask on.
Yeah. You got to do that. Be prepared. And and
I would even go so far as before I even sit down, just to kind of wipe that chair down. That's just me.
Well, yeah. And if you can't find any Lysol wipes or anything like that, what you can do is get some bleach and water and put it in a plastic bag and put some wipes in there and soak them up and carry it with you in the Ziploc bag, and make sure you got some gloves, of course, and
wipe it down.
Wipe it down.
Right.
And it doesn't have to be that much bleach because you don't want to stain the chair. But if you don't got any sanitizer wipe, Lysol wipes, or disinfectant wipes, bleach is the best thing for real. Right. But it just discolors stuff.
Right. Because if you think about this, the cleaning crew doesn't come into the end of the day. So you have 2 shifts of patients.
Right.
One after the other. Who's cleaning?
Yeah, not the staff.
No, staff.
Only thing they're cleaning is the machine. But who's dumping the trash? Stuff like that.
Until the end of the shift. I'm sorry, the end of the day.
Yeah. Check this out. It says, if you are in a private setting and do not have on your cloth face covering, remember to always cover your mouth and nose with a tissue when you cough or sneeze, or use the inside of your elbow. Now, this is the thing, Tamika. When you see this from the CDC, right? And it says, and this is what's so mind-boggling. Why, when I see people taking it so seriously, people are dying, but why would they say, if you're in a private setting, if you don't have a mask, to use other precautions? You see what I'm saying?
Well, maybe they want you to create a habit.
Exactly.
They want you to create a habit of coughing into your arm.
Like this.
Right.
But again, this is the stuff that people should have been doing before COVID-19.
Right. But a lot of patients don't think about doing that because the arm that they will cough into is their access arm.
Right,
And
right.
then they have the blood pressure cuff on the other one. So that means if they're coughing into the arm where the blood pressure cuff is at, that just don't make any sense.
Yeah, I mean, if you got tissues, you can use that, but
Right. So
it's just
the
crazy.
dialysis clinics are actually supposed to have tissues available for that.
Right. Now, I mean, now more than ever, because they used to have tissues, and because patients would ask for a box of tissue to blow their nose, whatever the case. But I'm sure those supplies are going through fast.
They've been dwindled down. Years ago, they stopped having that stockpile of, tissues and stuff like that for the patients.
Yeah, yeah. I want to give a shout out to David Bellum, Warrior watching from Ohio. Thanks for watching, David. Please subscribe to our pages, Urban Health Outreach Media, Urban Kidney Alliance, and our YouTube page, Urban Health Outreach Media. Thanks for watching.
Thanks for watching, David.
Yeah.
Also, before they even come into the treatment unit, they're supposed to be assessed. Not assessed as far as their heart rate, but assessed as far as asking them questions and also getting their temperature.
Yeah, that's on there as well. Actually, it's under the CDC preparing the unit.
Yes.
And that was one of the things, like you said, calling the patient or having the patient call in if they're sick. And then they go to say that, and I'm sure you've probably seen this in your unit, the changes at the clinic as facility prepared to keep patients, quote, safe during treatment. It may include signs with special instructions for patients with symptoms of COVID-19. Have you seen that at your unit? Signs for special instructions if someone is positive for the COVID-19?
Yes. I've recently seen signs. I think those signs should be a little bigger. Not just on the 8x10 legal paper. I think it should be a poster. Something for the seniors really to read.
Yeah, because a lot of seniors have eye vision challenges.
Right. And Steve, not just that. Sometimes the unit can have so much literature on the wall that it's dismissed.
Right. It kind of blends in with it.
It blends in, so they don't know what's new and what's old. Even as staff member, if I'm not standing there perusing on the wall, whatever, I won't know because all of it looks the same.
Wow. So it's not distinguished.
It's not distinguished. And I think something like that should be. I also think that they should get some better literature about what exactly to do, what information to put up so family will know what to do just in case this happens, how they're going to get care, where they're going to get care at. I think the unit should already have that on a piece of paper given to the patient to take home to post on the refrigerator.
Absolutely. And that goes into the next part of preparing the facility. Additional education about hand hygiene and cough etiquette. Is that, have you seen that being done? Not just at your unit, but at other places?
I've seen literature, but sometimes, Steve, I don't think literature does it. I think a demonstration does it better than the literature because sometimes people just don't read.
That's true. That's true. And we've seen that with labs and documents, memos that are being passed out to patients, and they may just put it in their bag and forget about it and said, had the very great intentions of looking at it later, but maybe forget about it.
Right. Because people have their own rendition of how they wash their hands. Some people may wet their hand first and then use soap. Some people may put soap on first, then wet their hands. though it's pretty much doing the same thing. If it's a certain protocol to go by, that's what you show them. I prefer you wetting your hand first and then putting the soap.
Laving it up, right.
Right. Some people don't do that. Some people put the soap on their dry hands and then put it onto the water.
Mm-hmm. Now, what about waiting areas will be divided for patients with symptoms and patients without symptoms?
I'm sorry, Steve. Joseph has a question. Joseph Patterson has a question.
I ain't gonna put it up on the. All right, Joe. What'd you say, Jared? Jared says I wear a mask when I go to the grocery store. I don't trust some of these foods.
Hey, I don't blame you. I don't blame you because COVID is like a thief in the night. You don't see it coming. And some
I don't know, Joe. I don't know. But look, speaking of that right quick, she's going to be on next Monday at 8. We're going to have the cast of that hit video that's out that by Donate Life with all the transplant ladies doing the almost something like that TikTok rush.
Oh, right? Okay.
Yeah, it's a video. I forgot the name of it, but it has Donnell in it.
Mm-hmm.
Tamika, Smallwood, Ebony, Tanisha, and
that's gonna be fun, Steve.
2 other people. So it's the whole cast.
Okay.
Yeah. That's this Monday. They're gonna talk about the video, putting it together.
Okay.
You know, it's up to I think 2,000, 3,000, 4,000 views now.
Oh wow. Okay.
Yeah. So Joe, you got jokes.
Joe trying to start. You trying to start, Joe? Look, Steve, long as Jared don't say let us sing. Okay, all right, let's go back.
All right. So, but what about in the lobby? Do you think lobbies are big enough to separate patients with symptoms and patients without symptoms?
For one, the patients with symptoms shouldn't even.
They should be on the last shift.
Yeah, they should be on the last shift.
Or a shift that's designated just for COVID-19.
Right. Or isolation. They should come in after all the patients have came in. They shouldn't come in there with the patients. But at the same time, if the patient have to use the bathroom, you can't deny that patient a right to use the bathroom. So they'll be using that bathroom with everyone else unless they designate a patient. Unless they designate a bathroom just for COVID patients.
Or a bedpan.
That too.
Do y'all still use bedpans?
I haven't seen bedpans used since the 90s, Steve, in the dialysis unit.
Right. What about urinals?
Yeah, the urinals. Mm-hmm.
Yeah, but they do have them in acute units.
Okay, I haven't worked in acute units.
Yeah. So what about changing patients' chair location, treatment times, or days? That falls in with changing the patients to third shift or whatever shift you covered.
Well, they probably do have to switch around the shifts to accommodate the COVID patients to be at the end of the day or whatever. So yeah, I've seen that.
Well, Dawn, she was on the show. We did a report Sunday on World Kidney News.
Mm-hmm.
And she mentioned that they cutting treatment times in New York.
Why?
I guess so they could make room for a 4th shift, for a COVID shift.
So you mean to tell me that if a patient gets off the machine early, they have to sign an AMA, but if you are opting to take that patient off early, it's okay?
Well, we didn't get that deep into it, but
No, I mean, because that's what it sounds
yeah,
like.
yeah. I mean, and we're going to definitely bring Dawn back on to talk about that. But they're saying treatment times are being cut.
But usually, Steve, Tuesday, Thursday, Saturdays are the short treatments. So why can't they put them on those shifts instead of cutting vital treatment times?
Yeah. Oh, I mean, you already know the answer to your question.
But do they
The
know they only have to
manpower.
get off
The
that machine?
manpower.
Do they know they have a right?
I, you know,
They
I
have
don't
a
know. You
right.
know, when we're dealing with these big companies, I know.
No, they go back to the paper that they signed about their treatment time and what their treatment time is and their patient rights.
Oh, absolutely. Go back to the informed consent.
Yep. Mm-hmm.
Yeah, I mean, and that's why we do these type of shows to inform patients that you do have rights,
Yes.
and all you have to do is go back and look at your paperwork, especially informed consent, because a lot of people, Tamika, and let's just be honest, a lot of people get that stuff, and I'm not saying all, but most majority of people probably thrown their informed consent away,
First of all,
or
Steve,
put it somewhere and can't find it.
when they get that information, they're just being thrown in the unit. So they're still trying to process it. They're not processing their paperwork, they're just signing it.
That's
No
why they
one
need an
comes,
advocate like us to go in with them.
right. No one comes back around 3 months later and have this same conversation when they are a little stable and where they kind of understand their treatment more to kind of say, okay, so when you first started here, I just want to reiterate what we talked about. And this right here was on this paper. Do you understand this now that you've been here? Do you
Good,
really,
good
do you,
point.
do you have any questions now that you've been here? Is there anything that we can assist you with since you've been here?
Yeah, yeah. And you know, a lot of that stuff gets falls through the cracks.
Mm-hmm.
A lot of that falls through the cracks, unfortunately. And that's again, I go back, that's why we do these shows, because we don't let that type of stuff fall through the cracks. You know, we have different shows. We may not talk about it on this show, but it may be on another show. But all in all, we talk about these things that are rarely talked about in the units because no one has time to
Talk about that
talk
now.
about it with getting in the unit and getting out. That's they like someone told me the other day they felt like they're in a factory because they go in and it's like go in and come out, go in, you know, you got one shift come in, they do certain things, you know, they bandage them up, they ship them out, and, you know, then they bring in the next people, and if you're bleeding, they'll put you to the side
No.
and make you hold and pull another chair up and put the other patient on and forget about
They're
you.
not supposed to do that. They're not supposed to do that. Those patients are supposed to be out of the unit before they bring patients in.
Yeah, yeah,
And
and I
that
don't
right
think
there,
that's maybe I don't know if that's still happening now with the COVID-19 situation, but
that
I've
right there,
seen that many times.
right, that right there is a breeding ground for infections, cross-contamination, and death.
Absolutely, absolutely. Now, what about a change in the gowns, face masks, and eye protection that the staff wear? Has anything, far as in your situation, changed? Like, did you, if you didn't buy that shield, does the company you employ it with provides the
Yeah,
proper? I know they provide PPE, but do
yeah.
they have the necessary supplies now? Because I know at one time y'all were
There's
falling
still a
behind.
shortage. There's still a shortage, but we do have it. We just have to hold on to it longer.
So you got to wear the same mask for several days.
No, we have to wear that mask all day long.
Oh, and then at the end of the day, the
Then
next day you get a new one.
yeah, the next day you get a new one.
Okay. It's not like how we used to do it, grab a mask, have it on, you leave off the floor, throw it away, and then you come
No,
back from lunch, you put on a new one. Those
nope.
days are gone.
Those days are gone. Those days are gone.
Wow.
Yep. So you have this mask on all day long. And then what people don't know is the mask breaks down in a matter of hours. So the protection that you had at 4 a.m., you don't have at 12 o'clock p.m.
Mm. Are they, how are they distributing the mask? It's not in a box out in the unit and you can just grab one?
No, the nurses distribute it. If they did that, I would take 2 or 3. I'm not gonna lie. I would.
So how we know the nurse is not sneaking some in their pocket?
I don't know, but if I find one, I'm gonna tell them, I'm gonna tell if they don't give me something. It's like
Nah, man, I'm just saying they lucky I'm not working. I mean, because I was just telling somebody the other day, we before this whole COVID, like 2 or 3 years ago, even up to a year ago, man, so abundance to get that stuff all over the place. And I said to myself, if I would have knew this was coming down the pipe, I would have been stocked up on the hand sanitizer, alcohol. I mean, all that, the pads.
the supply is out there. It's just in the wrong people's hands.
Yeah.
They're selling the mask, the surgical mask that we use, for $15 for 10 of them.
Wow.
Yes, they're selling the blue ones and they're selling the white ones.
Right. And then I guess somebody buy that and then resell them at a markup.
Yes. I've seen them sold on the physical street corner, and I've seen them sold in the dollar store, in the Chinese, dollar store. So the supply is out there, but they're in the wrong hands. If you was to walk down the street, you'll see more people in surgical masks than what we have in hospitals and in medical clinics.
That's crazy.
Mm-hmm.
That's crazy.
Mm-hmm. Yep.
And we used to get down really in abundance. I mean, it's just crazy.
But see, Steve, this started January 13th. So if we were alerted then, we wouldn't be where we are now.
Mm-hmm. Yep. Let me ask you this. Do the visitors or the people sitting in the lobby, are they wearing face masks and PPE?
Not PPE, face masks. I feel like there really shouldn't be any visitors there because you don't know what the visitors have, and the visitors can be affecting the patient. But then again, the transportation could be also affecting the patients too, because you have patients from different clinics in one bus.
Yeah. It's funny that you said that. The other day, I ran into a Metro Access driver. That's one of the state contract buses that pick up patients and take them to treatment. Mm-hmm. And I was asking him, because he was sitting out in front of a dialysis unit, and I just happened to be near there. So as I was asking him how they treating this, and he didn't have a mask. The company didn't supply him.
What?
No mask or anything. He's saying that they told him that the dialysis unit is supposed to contact and let the transportation company know if the patient is COVID-19 positive or not. So the driver could be prepared. Or they catch another way. They can't catch the bus if the patient is COVID-19 positive.
That's stupid. Everyone should be treated as they have COVID.
Yeah.
Wow.
Yeah, I hear the reality of the streets.
That's crazy. That's crazy.
Is that you with the sirens?
Oh yeah. Somebody probably got shot.
It ain't funny, but that's what I said. We're hearing the reality of the streets.
Yeah. It's what happens when you don't stay in the house. I don't understand how people getting shot in the head in Philadelphia.
Wow.
Multiple people getting killed. It must be
So,
cool.
guys, y'all hearing this? This is live. It's not Memorex.
Yeah. Something happened.
Yeah. So let's talk about, as we coming down to the end, the monitoring symptoms. And again, these symptoms mimic the flu: Tamika, fever, a new cough, sore throat, tiredness, shortness of breath is not, not part of the flu, but the muscle aches.
But Steve, a very important one. No taste and no smell.
Really?
That's a dead giveaway. Yes. That's a dead giveaway. If a patient has no taste and they can't smell, that's a sign of COVID.
Right, but yeah, and then but you have people who can have it and not be affected.
Yep. You have people that have no symptoms but are carriers. And that's why everyone should be treated as if they have it, because you just don't know.
I know. You just don't know for 2 weeks.
Yeah.
I would think after 2 weeks pass away and you don't have any symptoms, you ain't got it.
Yeah, but some people can still be like a carrier of it.
I was at the VA hospital yesterday. They closed all entrances except one. There was a guard there on post who asked you a list of questions before allowing you to enter. Once I arrived at the ER, there was a nurse at the front door who repeated the questions, handed me a mask, though I had my own, then took a picture of me. What? Was you working, man? Or you was going to the ER? Or you were just taking care of business? Wow. Wow. That's serious.
But why did they take the picture? That's what I'm trying. Maybe I don't know.
You don't know. I don't trust anything with the government. I'm just gonna put it out there. But it also says if you feel sick or think you may have been exposed to COVID-19, call the facility right away to let them know. And it allows for the facility to plan for you or send you to the hospital.
Yes, or you take yourself to the hospital.
Right, that's what I mean.
The facility don't want you to come in. If you feel sick, the facility don't want you to come in. They want you to go to the hospital. You coming in, you can get other people sick.
Right.
So it's best for them to go to the hospital.
This whole thing reminds me of The Walking Dead, man. I'm just gonna be honest with you. Like, you don't know who's infected, and next thing you know, somebody's eyes be bulging out and zombies and damn. It's just
it's real.
Yeah.
It's real. So you have to take these precautions.
And especially if you have a chronic illness.
Yes.
Especially if you have a chronic illness.
Right. And then the patient can be fine and then they'll pass away. So you really have to take your precautions with this. Washing your hands, social distancing, wear a mask.
Right. And speaking of mask, we have I don't have it on this overlay, but Michael Scott, right? Yeah, of Dialysis warrior gear. He has masks. It's just not on this particular. The pictures are not on this particular frame, but we have his information down. He has 2 masks for $12, I believe.
Yep, and they're made very well too.
All right, yeah.
Check
So
them
if you
out.
got, check out Michael Scott. He's a dialysis warrior. Had a transplant and started sewing as a result, and now he makes all kinds of gear, the mask, dog apparel,
yes,
shirts, and the dog apparel has transplant information or any information that you want on it. Have your dog advertising.
Yep.
So Tamika, so what do you think? How long you think this is going to be here?
This is going to be around for a while, because what's going to happen is people are going to get affected like this, especially if they're not using precautions.
Right.
If they're not washing their hands, if they're not covering their face with the face mask, because sometimes the face mask gets hot. And I tell people, like, if the face mask get hot and you're around a bunch of people, go outside and take the face mask down some.
So Tamika, what happens to the patient that may have an access in their arm or leg, and that's an elderly that can't hold it? What happens to them when we pour the needle and they normally have their caregiver come in and hold the site? Now that they can't come in the unit, who holds their site now?
We hold it.
And what about if your patient come off the machine while you're holding the site?
Hopefully the nurses will help us.
Wow.
But what we do for those patients whom sites we have to hold, we kind of put them on last. So we're taking care of all the other patients first. And then
when they come off, and then, right.
Yep.
Hey, Lisa. Wow.
Hi, Lisa. How are you? Yeah. But yeah, everyone just needs to be treated as if they had the disease. And I think that will help a lot. If everyone is just treated as if they have it and they're washing their hands. In other words. Yes. Yeah.
Yeah, that's
crazy. A lot of people that develop kidney failure. I was listening to the CDC, and a lot of people develop kidney failure from COVID.
Yeah, that's a different show, because I read an article on that. There's not enough dialysis machine. Nurses, you got nurses doing crazy acutes.
Hold on, I got something for you for that. So there's some places that stop the home hemo program to give those home hemo machines to the hospitals because there's not enough dialysis machines.
What? Wow. Is that in Philly? Oh, you're not saying? Hello? Oh, okay. Oh, what you see no evil, speak no evil, hear no evil.
Yes.
Speak no evil.
Yes. Yep. There's places.
Wow. So some places, or there's been a place that has stopped their home program temporarily so they could loan machines to the hospital. And we don't know which hospital, but that's happening. Wow. You would think companies like Fresenius that makes the machines and all these places, you can buy a machine on eBay for $500.
Yep.
So, I mean, I don't know what's going on.
Yeah. Deep, right?
It is.
Yeah, very interesting what's going on behind the scenes.
Yeah, right. Wow, we did discuss that.
Oh,
So,
oh wow, that people was gonna catch the flu?
well, this was a while back, before the COVID even popped up. We
Mhm.
were talking about patients contracting that the flu vaccine. I mean, the flu, influenza. Because
Mhm.
Joe works sometime in nursing home, so we had some time conversations about the care. So
Right, and I think that all patients should get the flu shot. This will help us some, but a lot of patients don't want to do that, and you can't make them.
that's true.
You
That's
can't make
true.
them, so it's just like. But
Yes.
once again, I think everyone, whether you have a chronic illness or not, should just take the proper precautions and treat everyone as if they have it.
I agree. I agree, Tamika. You got to treat everyone as if they was affected until.
This thing is real. It's not a joke. People are dying, you know, and they're dying for one. There's not enough. There's not enough medical equipment to go around. It's not. So they have to pick and choose.
Mm-hmm.
And then if you're overfilling the hospital with sick people, what's going to happen? It's going to be more casualties because they can't get to everyone.
Mm-hmm. Yeah. Well, yes. Next week we can report back and see. Hopefully, have a tally of what's going on. Maybe bring Don Edwards on with some news of what's going on. You know, Don is on the New York State COVID Task Force, ERSD Network 4
Right.
COVID task. Yeah. So,
Yeah. I mean, this thing is crazy, and I don't see it end anytime, Steve. I don't. This is our new normal. What we known as life before is not anymore. This is our new normal. When I see you, Steve, I'll be wearing a face mask. And it's not saying that I have it or you have it. It's protecting ourselves and our families.
yeah. I can't tell you I'm going to be the same because, you know, I just had different views on that. I mean, I'm definitely keeping safe because of my parents. You
Right?
know, that's the forefront. But
And
at
then
the same right, but at the same time, I'm using common sense and evaluating each day as it goes by. Because anytime you can see a bunch of people in the rotunda in Washington D.C. protesting, and they don't have any mask on, and some people do. You know, it's just something that just doesn't sit well. And I know everybody got different opinions and views, but that's my opinion and view.
right.
And it just feels something's not right. If it was,
something's not right.
Yeah.
The map of how this virus spread is like something off of a sci-fi movie. It literally spread across the globe like this. Not jump, 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 jump here. It went just like this.
Yeah.
I'm still trying to figure out how the hell is in Madagascar. I'm sorry. How is the virus in Madagascar? You know, in different places, I'm trying to figure out how did it get there? Who the hell is going from China to there?
Yeah. Let me just answer a question on the my Facebook watch party. Monica Cooper asked, question, has there ever been lives lost because people became allergic to the treatment? And I would think she's talking about dialysis treatment. And if she is talking about the dialysis treatment, you know, you do have some patients who may have had an anaphylactic shock or reaction to the filter or maybe a medication administered on dialysis, but not from allergic reaction over the long term, but maybe when they first initiated something new, like instituted a new dialyzer or put the patient on a medicine that they never been on before, and they didn't know that they was allergic to it, and it caused some type of allergic reaction that maybe cause them to have respiratory distress or cardiac arrest. But those things can happen. It's right in the informed consent that allergic reactions and anaphylactic shock and different situations and even death can happen on dialysis. It doesn't normally happen, but it can.
It can.
Yeah.
I think we had more death when we was using the Renalin and the formaldehyde on dialysis when they had, reactions to it.
Yeah. I mean,
so today it's way more safer than how it was many, many, many years ago.
Yeah, I mean, I've seen places where on a dialyzer it clearly said for single use only, and they were reusing them.
Yes. Yep. So we've come a long way from that, but anything can happen.
Absolutely.
Anything can happen.
That's why there's no gray areas in dialysis. That's why we advocate the way we do. There's no gray areas because no one's loved one wants to hear that somebody wasn't watching their loved one, and as a result of that loved one died or passed away because they had a heart attack or something happened and somebody wasn't there to intervene to help them at that moment. So there's been a lot of incidents where people passed away on the machine, needle came out, or some type of unfortunate accident that cost the lives of a patient. And even going back to 2008, Tamika, with the Kimberly Science murders in Lufkin, Texas, the disgraced murderer dialysis nurse who killed several patients with the injection of bleach in their dialysis line.
They should inject her with some bleach in her veins. How about that?
Yes.
That's so sad. That's so sad.
Yes. Yeah. And so Lisa says that's what happened to her brother. I think her brother's catheter line separated and he bled out. Unfortunate incident.
Let me say, Steve, if anyone catheter port comes out, apply pressure.
Well, no, the port didn't come out. The line separated from the limbs.
What?
Yes, it wasn't tight.
Remember
when you do the lower lock, it's the lower lock, but it wasn't tight.
But remember, they used to have this long cap, and you connect it, and
but
then
that's Fresenius. That's that white piece.
Yes,
the white piece that prevented from that's after the fact.
Wow, I'm so sorry that happened, Lisa. Wow, that is so heartbreaking. That was a disaster in that unit.
Yeah, it's crazy. So, well, we're over our time. I mean, this has been a great show. It's always great when we, just talk like this freely or have a topic we talk about. We have so many guests on that we sometimes forget about how we first started out talking about
having topics,
topic, and the whole hour we talk about it and have people interact. But this is a better platform. It's not our cell phones anymore and Facebook Live, or Be Live. So this is
something new. But if anyone have any topics that you want us to talk about, if you would like to be a guest, contact Steve or I, or go on Urban Health Outreach Media page and go leave us a message. And someone
you know what? Elizabeth Sterling, she has polycystic kidney disease. She reached out to me several weeks ago, and wanted to hear about kidney stones. So I know it's a lot of, kidney conditions that we haven't even scratched the surface on, Tamika.
Right.
I mean, we talked about lupus. I think we talked a little bit, maybe like sickle cell cell patient, but there's Alport's disease that causes it, and other conditions that we have people on. But it's just so many other things that affects the kidneys that we just haven't even scratched the surface on. And we've been doing this like 3 years, because I known Jared and his brother. We just had an anniversary like 2 years yesterday or day before. Awesome. And I think before them, like we was together maybe a year, like what, 2017, 16?
Yeah, 2017.
Yeah.
Yep.
It's been like 3 years. We've been putting in work day in and day out. Oh, and James Fabian, aka Dad Vice TV. Yes. Thanks for watching, man. Look, I'm honored to have him on, Tamika, because the other night he did a show with a dietitian on YouTube, and he had on the live feed 555 people at one time watching the show, giving that dietitian advice with the professional dietitian on the show. They were going back and forth. Great show. And 575 he put.
Yes, I love his energy. He has great tonality.
I mean, who wouldn't? I mean, if I had kidney disease and it was stage 3 or 2, I'll be on this show watching it. I mean, I'll be going through all 60-something episodes. In fact, I advise some people to go to your site, James, who are dealing with stage 3. I gave them your information because who better? I mean, he's dealt with it, Tamika, and he's did the work to to do what he's done to get from 8 to 37.
Yes.
Who's better else to give that information to people that are at stage 3 or 4? I can't do it because I haven't been through that.
Right. Neither.
That's not what we do.
Yep,
we educate.
Great tips. He has great tips on caring for yourself with kidney disease. So check him out on YouTube.
Yeah, absolutely. So, I mean, this has been a great show. Again, I appreciate the people who've come on and watched. Dad Vice, Lisa, Baxter, Jared, a new friend from Ohio. What's his name? Milton? No, David. Joe Patterson. I mean, thank you guys for just engaging and writing comments, because that also helps. In the algorithm with Facebook. So we appreciate, all who joined the broadcast and participated in discussion and dialogue.
Yes. Yep.
So, let me see. James says, do a show on kidney stones, and I will help you guys get a big audience marketing it.
Awesome.
Okay. So I will get with you, and we're going to figure out a date, Tamika, so we can advertise and put up a big push for that.
Yes. Create a video so they can watch first, and then we can break down what the video is talking about and maybe get something that resembles a kidney stone. You get what I'm saying? Like what it actually looks like in your body.
It's like a calcium deposit.
Calcium deposits, right. But actually, you know how they had the little pebbles in the storage?
Right.
Kind of give like, this is what it looks like, but it's calcified.
Yes. Yeah, we're going to do this really soon. Soon.
We're still growing. So we thank everyone for their support. We thank our amazing team. Once again, Lisa Baxter, Jared, Dawn, Uncle Jim, Steve,
Tamika.
Yeah, when I'm here, I'm here.
Right. Yeah.
Yeah.
Oh, wait a minute. Number one search term on YouTube that is kidney related is kidney stone.
Wow. Thank you. Thank you so much.
Oh man, that's a good keyword.
Yes.
Thank you. Thank you. Thank you. God bless you, James. I appreciate you.
Yes.
Um, that was yeah. So we're going to definitely work on the show. Hopefully we'll be ready in about 2 weeks.
Yes.
And we'll reach out to their advice and we definitely go from there.
Yes.
All right, guys.
Stay safe. Wash your hands. Mask up. If you need masks, go to Dialysis Warrior Gear on SD. Tell them Steve and Tamika sent you.
Right. I was trying to see if he have a code that he could put in. Somebody go and find out. Oh, and tomorrow is the Are You Okay? Potassium Awareness National High Potassium Awareness Day, May 1st. The AAKP is doing a National High Potassium Awareness webinar talking about high potassium and what you can do to keep it lowered. So that's tomorrow. Go to the website. You can still register. It's going to be a great webinar.
Yes, yes, yes. And make sure you know your numbers. Those numbers can keep you alive.
Oh, yeah, absolutely. So absolutely.
Ask questions. Ask what's a better range. Though they'll give you, okay, this is good and this is the bad range. Ask what is the okay range to really be
in. 3.5 to 5.5. I mean, 5.0.
5.0. Okay.
Yeah. But
Steve, I was telling my patients, get to 4.7.
Right, right. Stay in the 4 range.
4, yeah. 4.7. Go to 4.8, you're still good. If you go to 4.9, you're still good.
Right. Oh, we also want to wish Leslie DeVoe. I remember your name, Leslie. No, but we also want to wish Leslie speedy recovery. She was in Piedmont Hospital with double pneumonia plus COVID-19, Tamika.
Oh, wow.
And she's doing well. She was watching the show the other night. She got to be in there by herself. She says the doctors don't even come in the room. So thoughts and prayers are out to you, Leslie. Also, a big congratulations to Rhonda D. Hill, who received her transplant Monday morning, I believe. Monday or Tuesday morning. She got a transplant in North Carolina at an undisclosed hospital. I'm not sure. She didn't mention. But, yes, so...
Wow, that's
people are still getting transplants even in the midst of this COVID-19. So even though we heard in the beginning when this was happening, a lot of places weren't doing transplant, it seems like people are getting transplants.
Praise God that those things are not being overlooked, especially if it's a healthy, person.
Yes.
Transplants are still needed. There's some people that can no longer mentally do dialysis.
You're right. You're absolutely right.
That call, because that is the one thing that's keeping them alive, is hope for that call, because they are mentally done with dialysis. And that's deep.
Yeah.
It's mentally done, Steve. Like they just be like, you know what, Tamika, I don't think I could continue this. If I don't get a kidney within the next couple of weeks or months, I just don't know how much longer I have.
Yeah. And unfortunately, I've met people who made that decision in my career. Not something easy to talk about, especially because when you meet patients and you're with them 3, 4, 5, 6 years, 3 days a week, it's almost like being with family.
My patients are my family. I love them. I generally have family love for them. They have helped me through some of the roughest parts of my life. They have
Same here.
they've wiped tears. I've sat there and cried with them. And, when I had my daughter, they embraced me with gifts and love. And, you know, um, that's one of the reasons why I went back. It wasn't for staff, it wasn't for money. It was for the patients.
Mm-hmm. Yeah, I wouldn't be here today if it wasn't for a patient. One of many people
Mm-hmm.
who got me to this point where I'm at today.
Mm-hmm.
Uh, encouraged me to go to school for nursing.
Yeah.
When I first got my associate's degree, yeah, I can't. I mean, yeah, I'll probably start crying and start thinking about the people that I lost over the 33 years that I've really, really come fond of. And, Friday, like through 2 years or work with them. And then one Friday, just like you think it's like any other Friday, I see you on Monday, Mrs. So-and-so. And then Monday comes and the patient, the chair is empty, and you wonder what happened. And then when you call the house to find out, are they coming to dialysis, that's when you hear the news that they passed away.
Mm-hmm. I remember when I first got pregnant with Zoe, and I was crying because I was like, oh God, I just came out of a marriage a couple years ago, and how my children going to feel. And, I'm over 40 and I'm pregnant. And there was this one patient, she prayed over me. Every time she seen me, she said, Tamika, give me your hand. And I would give her my hand, and she just would pray. And tears would just fall. And when I came back from having Zoe and I heard she passed, it just broke my heart, because I just wanted to tell her thank you. Because when the doctor said, oh, you're not going to make it, you got blood clots in your lungs and stuff like that, she was the one that kept praying over me. She didn't have to. I was just a technician.
You was more than a technician.
Yeah, I just wanted to tell her thank you. Like, thank you for praying for me.
Wow.
Mm-hmm.
Yeah, you was having the devil with Zoe. I remember that.
Oh my God, that was a rough pregnancy, but she stayed.
You made it through.
I made it through.
Yeah. We were praying for you as well on the show, and
I didn't think I was gonna make it through. I'm gonna be honest. I didn't know what the outcome was gonna be.
Oh, I know.
In my delivery, I started hitting, rock bottom pits of depression. Even being pregnant, it should have been like the happiest time of my life, but it wasn't. My mortality was at risk.
Right. Oh, I remember you. I'm proud of you because you poured through. You definitely. I know it was some dark times, but you definitely poured through.
Dark times, Steve. Very dark times. It was times where I was like, you know what? I'm just going to end it here. No.
Yeah.
But anywho.
All right. So y'all guys got a chance to get an insight of Tamika and Steve. I mean, we have shared many times. Yeah. The real us.
The real relationship Steve and I do have. Steve is my brother. He's not my brother through blood. He is my brother through God. That is my brother. I love Steve dearly.
Yeah, I love you as well, my sister.
Yes.
So
I would drive all the way down to DC to bust Steve upside the head if I had. Okay.
All right, boo.
Okay, yes.
Yeah, you're something else.
So we're going to end this show. I just want to tell everyone that your kidneys do matter. Stay safe. Wash your hands. Social distancing so we can flatten the curve. Do not do what Trump said to do about the cleaning products. Ingest them. Please don't do that. Something wrong with them.
Right.
Something wrong with them.
I ain't never heard no crap like that, man, from any president.
What they say, God bless fools and babies. So,
right. I ain't gonna talk, but I'm just saying I ain't gonna get into no politics. But I ain't never heard from no president no silliness like that. Even if you was thinking to yourself of letting something like that about disinfected inside and infrared shit like that. But anyway.
Yeah. But everyone have a good night. Stay safe. God bless.
That's really, stay safe. God bless. And remember social distancing, 6 feet apart, and your mask.
Yes.
Good night.
Good night.
All right, Tamika. Peace.
Peace.